Good afternoon, everyone. Thank you so much for joining us here at the Queensway Carleton Hospital. My name is Yvonne Wilson. I'm the Vice President of Patient Care and Chief Nurse Executive at the Queensway. This is a very exciting day for nursing and right across our country. I would love to welcome our guests, the Honourable MP Yasir Naqvi. He's the MP for Ottawa Centre and Parliamentary Secretary for the Minister of Health. And Dr. Cynthia Baker. She is the Executive Director for the Canadian Association of Schools of Nursing, and everybody who's joining us in person and virtually, welcome. Prior to handing over for our announcement, I'd like to make a land acknowledgement. It is important to acknowledge that the Queensway Carleton Hospital is located on the unceded territory of the Anishinaabe and Algonquin nations. This land continues to be home to diverse Indigenous peoples, including the First Nation, the Métis, and the Inuit, who we recognize as contemporary stewards of the land and whose presence here reaches to time immemorial. So we're here to talk about nursing. And Queensway was an early adopter of the Supervised Practice Experience Program for internationally educated nurses. And we've had great success with our program. Since launching in the spring of 2022, we've hosted 46 program candidates and have hired 31 internationally educated nurses. We are incredibly lucky to have such valuable members to our team who bring great skill and knowledge with them, and they were a key element in reducing our nursing vacancy rate by 35% since 2022. I'm very excited for this announcement, so without further ado, please help me welcome Minister MP Yasir Naqvi.
Well, good afternoon, everyone. Thank you very much, Yvonne, for that kind introduction. And I have to say, Dr. Faulkner was just raving about you as we were walking in about the incredible job you do. So thank you. Yes. And thank you for all of you for being here. I want to thank Yvonne for starting by acknowledging that we are meeting on the traditional land of the Anishinaabe Algonquin people. I think it's important that not only we do the acknowledgement, but with acknowledgement comes a recognition on the land we live on, and a commitment to continue to learn from Indigenous communities who've lived on this land for a very, very long time, and make sure that we be just like them, good stewards of this land, and we have a lot of work to do in that regards. I'm thrilled to be here at Queensway Carleton Hospital. It's been some time. I think last time was before the pandemic that I visited. So I want to thank Dr. Faulkner for his friendship and his kindness, giving me a very quick tour of exciting things that are happening, and how Queensway Carleton Hospital is serving our growing community here on the west end of the city. So thank you again to you and through you to the entire team at Queensway Carleton for the incredible work you're doing. I also want to acknowledge my good friend and colleague Anita Vandenbeld, who's the Member of Parliament for Ottawa West Nepean. She was unable to be here with us today due to some other prior commitments, but Anita is a tireless champion of important public services here in the community and of Queensway Carleton Hospital. So I just want to thank her for the hard work she does. And all of you, we work, our healthcare system works in partnership with the frontline workers like yourself, and it is incumbent on us to continue to listen to you and keep working together. And as a result of that, last year we announced $2.4 million in federal funding to the Canadian Association of Schools of Nursing to establish the National Nursing Residency Program. Today we are building on that work. And it's my pleasure to announce on behalf of the Honourable Mark Holland, the Minister of Health for the Government of Canada, that the Government of Canada is investing more than $388,000 to further support this particular program. This funding will help internationally educated nurses, or IENs, be a part of the residency program. This initiative will help nurses who are new to Canada's healthcare system integrate into the Canadian workforce. J'ai le plaisir d'annoncer au nom de l'Honorable Mark Holland, ministre de la Santé, que le gouvernement du Canada investit plus de 388 000 $ pour soutenir davantage ce programme. Ce financement aidera le personnel infirmier formé à l'étranger à prendre part au programme de résidence. Cette initiative aidera les infirmiers et infirmières nouvellement arrivés dans le système de santé canadien à s'intégrer à la main-d'œuvre canadienne. For example, newly hired IENs will be paired up with experienced staff, nurses, and supported directly in healthcare organizations. By pairing IENs with experienced nurses, this mentorship program will help new nurses get the skills and confidence to succeed in their roles for many years. We know that nurses need to be adequately supported to be retained in the healthcare system. Organizations will also be provided with the support and tools they need to create inclusive, diverse, and sustainable healthcare systems. Earlier this month, the Minister of Health, Mark Holland, and Canada's Chief Nursing Officer released a new resource to help employers support nurses to stay in the jobs they love. The Nursing Retention Toolkit will provide Canadian nurse employers and healthcare organizations with practical strategies and tools to improve the retention of nurses. Created by nurses and for nurses, this toolkit draws on evidence-based practice and the direct experiences of point-of-care nurses. The toolkit is also informed by insights from nursing professionals at all stages of their career in a variety of healthcare sectors and provides advice on how to support nurses on the job and foster a positive workplace culture. I think all of us will agree that it's a really challenging time in healthcare profession, especially for our nurses. The COVID-19 pandemic put incredible strain on the healthcare system and on the dedicated professionals who keep it running. I want to take a moment to thank all of the healthcare workers who show up every day to care for their patients. I recently had an opportunity to take my son to an emergency room at CHIO because he was not feeling well. And the over few hours that we were there for him to feel better, we interacted with 3 nurses in that interaction. Every single one of them, even though it was middle of the night, were at their very best. And you know, it's funny, as a politician, you come to these settings, you're shepherded around one place to another. It's a very different feeling when you go as a parent, when your child is not feeling well, or it's yourself who may be going, and the anxiety that you feel. And those 3 nurses were remarkable. For all the challenges, for all the patients they were seeing, it was so reassuring to be in the system and to receive the care, which resulted in my son to feel better, and we were able to eventually go home. So I want to really thank you for everything you do every single day. Nous vivons toujours une période difficile dans le secteur de la santé, en particulier pour le personnel infirmier. La pandémie de COVID-19 a mis à rude épreuve le système de santé et les professionnels dévoués qui en assurent le fonctionnement. Je tiens à prendre un moment pour remercier tous les professionnels de la santé qui se présentent chaque jour pour s'occuper de leurs patients. I know it's not easy. I know there are challenges and there are ongoing challenges that we need to keep working together. But Canadians see your efforts like I did, and your work matters. And we are working hard to help support you. To this end, the Government of Canada is stepping up to build a stronger, more resilient healthcare system for health workers and for all people in Canada. We're investing close to $200 billion over 10 years to improve healthcare for Canadians. This includes $25 billion through tailored bilateral agreements with provinces and territories to advance shared health priorities. Through these agreements, we are supporting the provinces and territories to find targeted solutions to long-standing challenges such as the recruitment and retention of healthcare workers. And this is the key. And I think there's an opportunity for all of us, especially when it comes to internationally trained healthcare professionals to really come up with new ways in getting them part of the profession. We're very lucky in Canada to attract the best and the brightest of the world. They want to build their lives right here in Canada. My family did that 35 years ago. And they are professionals. They have gotten the education. They want to work in their own professions, and so many of them come from the healthcare field. And this kind of work that you're doing is absolutely necessary. For that, we need to push harder. I think we need to push the federal government, everything that we can do with supporting programs like the one we are doing today. We have to push our provincial governments that control the delivery of healthcare, and our regulators as well, our colleges of nursing and physicians and other allied healthcare professions to do better in recognizing the credentials and licensing of internationally trained healthcare professionals. With so much pressure on the healthcare force right now, we need to do everything we can to help recruit new healthcare workers as well as retain existing members of this vital workforce. We're working with our partners on new initiatives like this one to ensure that healthcare workers can thrive at work, not just survive. Today's announcement is just one example of how the Government of Canada is working with the nursing community to build capacity as well as address challenges in the nursing profession, improve retention, and strengthen Canada's health workforce. Before I close, I want to thank you again, thank all the nurses, both new and experienced, for their perseverance, professionalism, and unwavering commitment to all patients. Nurses make an impact every day, and Canadians are inspired by your care and compassion. For our part, the Government of Canada will continue working with provinces, territories, and health partners to make Canada's health system the best it can be, both for patients and for health workers. Thank you very much again, and it's my great honor to welcome Dr. Cynthia Baker, who's the Executive Director of the Canadian Association of Schools of Nursing, to come forward and see viewers. Thank you very much. Merci beaucoup.
So thank you very much. Merci beaucoup. Thank you, Yvonne. Did I call you Yvonne? I was introduced to a quick tour of the hospital, and I was very impressed and very excited to hear what has been happening in this in Queensway Carleton Hospital. We've already started exchanging with some of the nurses involved in the IN program, and we're hoping that we'll be able to continue the dialogue with these nurses. So the Canadian Association of Schools of Nursing is the national voice for nursing education, research, and scholarship, and we represent baccalaureate and graduate nursing programs across the country. Our mission is to promote high-quality nursing education, nursing scholarship in the interest of healthier Canadians. And certainly the mentorship, preceptorship of internationally educated nurses falls into our scope and into our mission. Alors, l'Association canadienne des écoles de sciences infirmières, la CASN, est le porte-parole national pour la formation infirmière, la recherche et le scholarship. Il représente le baccalauréat et les études supérieures des programmes de sciences infirmières au Canada. La mission de la CASN consiste à orienter la formation infirmière et l'avancement des connaissances en sciences infirmières pour appuyer une meilleure santé des Canadiennes et des Canadiens. Like CASN's nurse residency program for new graduates, the IEN mentorship program will be delivered through partnerships with healthcare agencies. It will support the retention and integration of internationally educated nurses in Canada's healthcare workforce by reducing transition stress, reducing cultural shock, and helping them integrate into a new society's healthcare system. The IN mentorship program offers a cost-effective solution that will help healthcare agencies achieve appropriate staffing levels and decrease costs related to health human resources. Tout comme le programme de résidence pour infirmières et infirmiers, le programme de mentorat des IFE est un partenariat entre les organismes de soins de santé et la CASN. Le programme de mentorat des IFE favorisera la rétention et l'intégration des IFE en réduisant le stress lié à la transition et le choc culturel. So we're excited to get started. We think this is going to make a difference, and we look forward to partnerships with your hospital. I would like to finish by thanking Health Canada for supporting this program. So thank you very much.
Thank you so much. So our conference is ending, and we now have an opportunity for some questions, I believe. And there's a...
Yeah, right here. Thanks, Yvonne. So, bonjour, hello. My name's Andre Gagnon. I'm with Media Relations for Health Canada, pour Santé Canada. So if there's any media in the room that would have any questions, we'll start with questions in the room right now. I know we have a couple of media, but I'm not sure if it's mostly just here for recording. So if so, that's fine. So what we'll do is we'll go to Zoom, and if there's any questions on Zoom, please.
Thanks, Andre. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Just give it a few moments.
I call this the Viva Voce part of the whole exercise, the pop quiz. So.
I think you're okay. There's no questions on the Zoom, so that'll conclude today's news conference. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thanks and have a nice day, everyone.
Thanks so much, Mark. Thank you so much, everybody. Thank you. Yeah.